Asthma is a condition in which your airways narrow and swell and may produce extra mucus. This can make breathing difficult and trigger coughing, a whistling sound, wheezing, when you breathe out, and shortness of breath. Asthma can't be cured, but its symptoms can be controlled. Because asthma often changes over time, it's important that you work with your doctor to track your signs and symptoms and adjust your treatment as needed. Asthma signs and symptoms include shortness of breath, chest tightness or pain, wheezing when exhaling, which is a common sign of asthma in children, trouble sleeping caused by shortness of breath, coughing or wheezing attacks that are worsened by a respiratory virus, such as a cold or the flu. For some people, asthma signs and symptoms flare up in certain situations. Exercise-induced asthma, which may be worse when the air is cold and dry. Occupational asthma, triggered by workplace irritants, such as chemical fumes, gases, or dust. Allergy-induced asthma, triggered by airborne substances such as pollen, mold spores, cockroach waste, or particles of skin and dried saliva shed by pets. Pet dander. Causes. It isn't clear why some people get asthma and others don't, but it's probably due to a combination of environmental and inherited genetic factors. Asthma triggers are different from person to person and can include airborne allergens such as pollen, dust mites, mold spores, pet dander, or particles of cockroach waste. Respiratory infections such as the common cold, physical activity, cold air pollutants and irritants, such as smoke, certain medications, including beta blockers, aspirin, and non-steroidal anti-inflammatory drugs, such as ibuprofen, Advil, Motrin IB, others, and naproxen sodium, Aleve. Strong emotions and stress sulfites and preservatives added to some types of foods and beverages, including shrimp, dried fruit, processed potatoes, beer, and wine. Gastroesophageal reflux disease, GERD, a condition in which stomach acids back up into your throat. Risk factors. A number of factors are thought to increase your chances of developing asthma. They include having a blood relative with asthma, such as a parent or sibling, having another allergic condition, such as atopic dermatitis, which causes red, itchy skin, or hay fever, which causes a runny nose, congestion, and itchy eyes. Being overweight, being a smoker, exposure to secondhand smoke, exposure to exhaust fumes, or other types of pollution.